Caleb, you two are my partners, so you're with my crew, so I'll have you stand up. Okay, so how this is going to go for a trauma scenario is the first thing the evaluator will tell you is you respond on a 27-year-old male unresponsive in the street. So I'm going to say, BSI scene safe, is this my only patient? So BSI, body substance isolation, is my scene secure? Is this my only patient? If it's not, if I have multiple patients, I know I need to start requesting additional resources immediately. From there, I'm going to then start my assessment, and I'm going to ask the evaluator, as I approach the scene, what do I see? Do I see any large poolings of blood, any safety concerns, anything at all that would explain what's going on with the patient? And they would say, you know that there's an unresponsive 27-year-old male supine on the concrete. There's no large poolings of blood as you approach. Okay, great. I'm going to approach, and I'm going to immediately instruct Jared to grab C-spine. So Jared's going to grab C-spine. From here, I'm going to say I'm going to assess airway, breathing, and circulation. What is the rate and quality of my respirations? I'll say he's breathing 12 times a minute, non-labored. Okay, I'm going to palpate for a pulse. Do I feel a carotid pulse? Yes, you have a strong carotid pulse. Okay, wonderful. Do I note equal rise-fall of the chest? Yes. Okay. So I'm going to auscultate. What do my lungs sound like? You have clear lung sounds in all fields. Great. So from here, I'm going to start my rapid trauma assessment, starting at the head. I'm going to palpate the head. Do I note any deformities to the head? No. As I pull back, do I note any pooling or any blood on my fingers? No. I'm going to palpate the neck. Do I feel for step off? No. Do I note jugular vein distension or tracheal deviation? No. I'm going to palpate the chest. Are my clavicles intact? Yes. Palpating, is the chest wall intact? Yes. Equal rise fall of the chest? Great. I'm going to palpate all four quadrants of the abdomen. What are my findings? You have a soft, non-tender abdomen in all fields. Okay, I'm going to palpate the pelvis, pushing inward. Is it stable? Yes. I'm going to palpate down the patient's left leg. Any deformities, contusions, abrasions, punctures, tenderness, lacerations, or swelling? No. I'm going to palpate for a pulse. Is there a pulse present? Yes. Do I have a response as I squeeze the patient's toes? Yes, there's a sensation for pain. Okay, I'm going to go down the other leg. Same thing. Going to the arms. Now I'm going to roll the patient and instruct my other partner to grab the backboard.
We're losing him.
I'm going to have you place it on this side of the patient. All right. And then I'm just going to have you set it there, Caleb, and I'm going to have you apply a C-collar to this patient. So I've assessed for a motor sensory function before the C-collar. I'll make sure that I assess after that's placed. So what you're going to do is you're going to slide this end under. Very good. Flip the chin up. Bring that up and around because that should be secured first. Okay, and then Jared, I'll have you slide your right hand out and take over from that side of the collar.
Okay.
Beautiful. And then when you're ready to make the connection, pull the other hand out.
Just let me know when you're ready. Ready. Yep.
Okay, great. I'm going to reassess for motor sensory pulses. Do I have those intact? Okay, great. At this time, I'm going to roll the patient. I'm going to lift the arm up. On my count of three, I'm going to roll. 1, 2, 3, roll. I'm going to palpate the back. Any deformities or other abnormalities I need to know? No. Okay, I'm going to roll, get the board here, which we should have had this ready. Okay. On my count, we're going to roll. It's on your count, actually, on your count of three, since you're at the head.
On the count of three, we're going to roll him onto the backboard. 1, 2, 3, roll.
Roll. Okay, now, so since he's not on here evenly, we're going to do a Z roll. We're going to move him down on the board and then up. So I'll have you grab a shoulder off here to the side of the pocket.
Is that still on my count?
Yes.
Okay.
We're going to go down first.
Move him down on 3. 1, 2, 3.
And then straight up.
And 1, 2, 3.
Beautiful. At this point, we'll secure starting at the hips. So the rule of thumb when you're securing on a backboard is hips, nips, knees.
Now, do you want his arms to be inside those straps?
Yeah, so if he's unresponsive, good rule of thumb is play it safe and secure the arms, so that way you know they're properly secured. Beautiful. Oops. And then, I don't have head blocks over here. Let me grab those. Pause your video, sorry.
This is fun.
Hey, bud.
I know.
I feel great.
Do you feel secure?
Oh, yeah.
Cared for?
We got Ross.
You left.
I hate it.
All right.
Oh, yeah. I've been in it.
So from here, we're going to secure the head. Go ahead and slide your hands out. Beautiful. Go ahead and grab from the head blocks here for me. They were already attached a little bit.
Sir, please don't move your neck.
So we're always going to secure the head last. And then reassess MSPs again. That's a trauma assessment. Okay? Good.
6 minutes and 8 seconds.
So when you do this in real life, you have 10 minutes for your actual, and that was with a technical difficulty, right?
Yes.
So you'll have all your equipment available. So that's how it should go. Now,
Say.
there's different ways of doing it. So some say, and if you look at your registry sheet, hold up everybody. If you look at your registry sheet, there's a thing that says you do your primary, get vitals, then go to your secondary. What I actually didn't do was after I did that initial head to toe, what I should say now is I'm going to get vital signs on the patient. We're going to load and go, rapid transport to the hospital, and now I'm going to start my full secondary. Then we're going to go through this whole assessment again. Okay? So we'll get into more of the details with it, but I want you to be able to see how it should go. It's a lot of question-based practice, so know what questions to ask. Other than that, any questions about trauma? Yeah.
So when you check for his MSPs, is that what it is?
Yeah.
Yeah.
Motor
so,
sensory pulses.
Right. So when you check for that, does he respond? Like.
So
I-
in a
I
trauma
just-
patient, they might have painful stimuli response, maybe. Likelihood not if they're fully unresponsive, but we would still note it. We would try, but they would just have intact motor and they might just only have intact pulse and not have any motor or sensory. But we know that that's normal because they're unresponsive. Make sense? Okay. So we'll get you out of this, and then I need somebody who's a little bit creative,
I got
who can
you.
like act a little bit. You? You were first. I'll take you, Elizabeth. Or Liz, right?
Yeah.
Not Elizabeth.
Here, I'll just record it on my phone. Julia, here we go.